When you look around the world, you'll see many examples of very high quality healthcare, but they're not always accessible.
We saw a need to bring people into the UK for surgery. I was an expat myself in Hong Kong, and the healthcare there was good day to day, but anything major, I always felt that there was a language barrier or cultural barrier.
Britain sees more than 30,000 health visitors a year. Patients come for the highly regulated specialist healthcare. It's not surprising that the Commonwealth Fund rates British healthcare amongst the best in the world.
British medical training is challenging and a long process. Most specialists will undergo a minimum of 12 years training before being added to the specialist register. All specialists undergo annual appraisal, and doctors receive further training on fellowships and from the Royal Colleges. Cabot Clinic gives you access to this pool of highly trained specialists who will take care of you during your operation.
The mission at Cabot Clinic is to give you access to great British healthcare. We make the medical journey easier so you can concentrate on recovery. How do we do that?
First time you meet your consultant will be a remote consultation. During that consultation, we'll evaluate your condition and then offer you the appropriate treatment. We'll assist you if any further investigations, scans, x-rays are required before you travel.
You'll have no language barrier, we would hope. You would have the level of care you would be used to and expect from the British system, and a guarantee about our qualifications and how we can help you.
The Cabot Clinic pre-travel screening and your consultation will give you the confidence to travel for your proposed treatment.
The things that we focused on when we were setting up the clinic, firstly it was healthcare professionals, the people.
We use surgeons that have been in practice a long time and have built up a good team structure around themselves.
Second thing was the hospital itself. So not only do we have those university hospitals, we also have very good private hospitals.
Consultation and treatment takes place in carefully selected hospitals. These are CQC good rated hospitals with excellent track records.
Once you're in the UK, you'll be met at the airport by our concierge team and taken to your pre-arranged accommodation. A well-organised journey needn't be stressful. Discharge medications are included, and after a period of recovery and some final checks, the concierge team will take you back to the airport. Recovery continues once you're back home with ongoing remote physiotherapy.
We do everything for them, so if we are taking them to the airport post-operatively, then we will take them actually into the terminal itself, take all of their bags in, and find the special assistance team within the airport, deliver them to them safely so they can then take them for their onward journey onto the plane.
Planning a surgery starts from the very first moment we meet the patient. We think about their patient factors, their expectations, what they want out of the surgery.
If we take the example of a patient with knee arthritis, they'll often find that the things they used to enjoy in life have disappeared. And when non-operative treatments have failed, surgery can be very helpful. The implants used for surgical procedures in the UK are very closely scrutinised. We have a national joint registry.
Using the data from the National Joint Registry, our surgeons are able to choose implants with a proven track record, which are the safest for our patients.
How we keep our theatres safe for our patients. We are governed under the Care Quality Commission.
CQC, Care Quality Commission, assesses each healthcare provider in 5 main areas. Are they safe? Are they effective? Are they caring? Are they responsive? And are they well led?
About infection prevention. It's about making the safe standards for our theatres to make sure my patients have the safest possible journey to theatre in a clean and safe environment.
There have been many developments in recent years, but the one that stands out the most is the robotic-assisted knee replacement.
Now, it's not a robot doing the procedure, but it's certainly a way of fine-tuning that procedure to make it a little bit more bespoke for each patient.
Which is undertaken through a combination of CT scanning, which is then fed into the brain of the robot, which permits it to understand the exact position and shape of the patient.
And the beauty of that procedure is that we believe it's more accurate, more reproducible, and has lower complication rates and early improved function.
So we have a full range of options available for pain management after the operation, ranging from pain relief medicines in a drip in your hand, medicines you can take orally, regional anaesthesia, and a cold compression device that people find very helpful.
That stops all the swelling, and if you can get the swelling down, and the pain under control, you're away. I think I was out of hospital within 2 days after having full knee replacement.
The communication was excellent. The facilities were superb.
And from the time I stepped through the door, people were really pleasant, welcoming, they answered all your questions, the care was excellent.
We sort out the travel, the accommodation, the physio and anything else that you need, and that enables you, when you're having your surgery, to concentrate on the more important things.